Hello and welcome to Wellness on Wednesday, a captivating series that promotes walking as a powerful tool for improving health and reducing arthritis and joint pain. Wellness on Wednesday is a free virtual health talk series on arthritis brought to you in partnership with Rochester Clinic and Lotus Health Foundation. I'm Denise Siegel. I am the CEO and curator at livinghealthylist.com, and I'll be your host for this exciting program. Rochester Clinic and Lotus Health Foundation are known for their focus on community well-being, and they have spearheaded this series of health talks that addresses whole food plant-based nutrition and activities for the improvement of arthritis health. Now, thanks to Let's Walk Minnesota, a campaign that is sponsored by the Minnesota Department of Health and funded by the Center for Disease Control and Prevention, we have the opportunity to bring this initiative to you for the next 6 weeks. The goal, obviously, is to ease pain and improve quality of life for the adults that have joint pain, stiffness, or have been diagnosed with arthritis. And of course, we want to help people do that through walking or increased physical activity. In this series of talks, our presenters will help you discover the incredible potential of walking and teach you how to enhance your quality of life through movement, nutrition, and lifestyle medicine. Today, our presenter is Dr. Jengyu Lai. Dr. Lai he's a doctor of podiatric medicine and is certified with the American Board of Lifestyle Medicine. And he is here today to give us an introduction of lifestyle medicine and why it is effective in arthritis management. Welcome, welcome, Dr. Lai.
Today, I'm going to talk about introduction to lifestyle medicine in arthritis management. Again, Dr. Jengyu Lai, I'm a podiatrist by training from the Rochester Clinic. I'm board certified in lifestyle medicine. And today, we're going to talk about what are the common types of arthritis and what is lifestyle medicine and why lifestyle medicine is effective in arthritis management. And lastly, I want to introduce the presenters. Arthritis, by definition, is a group of conditions that are characterized by inflammation and pain in the joints. And here, there's two things I want you to pay attention to is, number one, pain and inflammation, they go hand in hand. Whenever you have pain, think of inflammation. And secondly, when you look at this, it's osteoarthritis on the foot or in the knee, even though there are osteoarthritis, by definition, there's not an inflammatory type of arthritis. It still has the inflammatory component to it. So even though it's osteoarthritis, it still has the pain and the inflammation. And when we talk about types of arthritis, there are three common types we talk about. Number one is septic, which is infection. So you look at all the infection around the joint, inflammatory, and osteoarthritis. For the septic, as I mentioned, it is the infection of the joint, and it can happen in three ways. Number one is direct inoculation, meaning there's an injury, trauma that introduce the microorganisms directly to the joint, and that will be the direct inoculation. Extension is the way, for example, there's a wound, chronic wound by the joint, and the microorganisms can migrate from the wound to the joint, and that's from the extension. And now the third one is if there's a microorganisms circulating in your body, and then they can also be introduced to the joint. So there's three ways, and it's not very common we see. However, number one is just for completion's sake, and number two is the septic arthritis a lot of time can be mistaken as inflammatory arthritis, and that's why I mentioned that septic. Inflammatory arthritis, most commonly we know rheumatoid, and we heard of the gout, and we know the psoriasis, and also in Minnesota there's a Lyme disease, and those usually will have a lot of inflammatory responses in the joint, and people usually describe the joint as warm and hot. And the next one is osteoarthritis. It is the most common type of arthritis. It affects 13.1% of US population, which is about 32.5 million of adults. It is the degenerative type of joint disorder. When you look at a normal joint, you can see a nice cartilage, the surface right here, and it has a nice space in between. There's a joint space, and in between here is the joint fluid or synovial fluid that lubricates the joint and also provides some cushioning right there. And in the osteoarthritis, the destruction starts from the cartilage and going to becoming what people describe as bone on bone. And that's osteoarthritis. Unless the osteoarthritis results directly from a trauma or injury, for example, sports injury or any type of accident that damage the joint, osteoarthritis is highly associated with lifestyle. What I mean by lifestyle, we usually associate osteoarthritis with overuse. No, he said we walk too much, we use our hands too much, so we have the overuse. However, inactivity will also contribute to osteoarthritis. When you look at one joint, either there's an ankle joint or the knee joint, the joint is not there just by itself. You can see all the muscles, tendons, ligaments surrounding this joint to not only support this joint, but also create the motions that the joint has. And the muscle that only works if it crosses a joint. So for example, this muscle crosses the knee joint, so it can act on the knee joint. And when the knee wanna have the motions, it have to move the muscles around it. That means if we don't move enough, the muscles become weak. And when the muscles are weakened, the joint cannot maintain its joint space, and it's going to create pressure inside the joint, inside the cartilage. And another thing is our cartilage, our bone needs stress in order to grow, to regenerate. That means if we don't have the proper activity, for example, like the walking, like the running, with the pounding forces to stimulate the cartilage or bone, they are going to become weak. And that's easier to get arthritis. And the next one is the nutrition. We need the proper nutrition as a building blocks for the cartilage, for the bone. For example, the cartilage and bone both has a lot of collagen. The collagen is very specific protein. It needs different nutrients at different stages of maturation. For example, it needs vitamin C, it needs zinc, it needs copper. So for us to produce the good mature collagen. So that's it. Nutrient. Of course, we all know about calcium for the bone. So for the nutrition, and then even we have the good nutrition, we still need a very nice circulation to deliver those nutrients to our bones, to our joints. And so when you look at this, now the activity, the nutrition, or the circulation, those are related to lifestyle. And that brings up to what is lifestyle medicine? According to American College of Lifestyle Medicine is the use of evidence-based lifestyle therapeutic intervention, which includes 6 pillars that I will discuss later, and as a primary modality delivered by clinicians trained and certified in this specialty to prevent, treat, and often reverse chronic disease. So let's come back to this definition. It is a very evidence-based specialty. And when we talk about primary modality, is we want to use this as the first treatment option instead of just talking to the patient, bring out our prescription pad and be done with it. That's not the lifestyle medicine. We want to look at the root cause. And it's delivered by clinicians trained and certified. Lifestyle medicine is recognized as a new specialty in 2019. So it's not just something that, hey, I want to do lifestyle medicine. No, it's really a true specialty. We want it a true specialty, and that's why the clinicians now can be trained and certified in lifestyle medicine. And it can not only prevent, treat, but often reverse the chronic disease. And to me, I like to put a simplified definition, meaning it is to treat the root cause by examining and making lifestyle adjustments instead of managing symptoms with medication. So we're in the business of treating the root cause and not just provide the symptom management, and that is the lifestyle medicine. So when we talk about evidence-based and also this lifestyle medicine movement, I always like to refer to the Blue Zones project. The Blue Zones project started out as a National Geographic project. The explorer, the muter, simply want to know where in the world people live longer and healthier. In this, that it is just a project. That means there's no preset objectives. There was no commercial sponsor to know whether dairy was good for you, whether broccoli was good for you, something like that. There was no sponsor. It's very objective. And that's why I always like to refer to this Blue Zones project. So when the explorer from 5 areas in the world where people live longer and healthier, he decided to see what one factor will contribute to this longevity and health. He couldn't find one. He actually found 6 or more. It's a nutrition, it's active lifestyle. Here I don't talk about exercise, it's active physical activities, and stress management, social connection, passion, and sleep. And that is the whole thing together. And that's how it started the current lifestyle medicine movement. The only Blue Zone in the US is Loma Linda in California. And what is a lifestyle medicine approach when we provide a lifestyle medicine? To me, there are 3 main differences. Number one is a whole person care. When a person comes in, we look at the whole person. We don't just treat the joint, we just treat the knee or treat the ankle, we treat the person. We don't just treat the disease. And second is a lot of education. We want to talk to the patient, and actually a lot of times is listening to the patient about what they have, how we can help. The education would lead to the number 3 is empowerment. The patient will take charge of their health. They will tell us what they want to achieve. It's not what we want them to do. It's what they want to achieve. And that is the main difference of a lifestyle medicine approach: whole person care, education, and empowerment. And why lifestyle medicine is effective in treating arthritis? I mentioned earlier, the definition of arthritis is the pain and inflammation in the joint. And right now, just like any chronic conditions we experience in our current society, those are contributed, those result from the systemic chronic inflammations. And those inflammation can come anywhere. It can come from your gut, from the diet, from your stress, from lack of activities, like that. And then those chronic inflammation would affect multiple organs in our body, including the joints. And lifestyle medicine is very effective in reducing this chronic inflammation in different pillars. And there are 6 pillars as I mentioned. It's really a plant-based nutrition. And those talk about physical activities, as I mentioned, it's not exercise. The reason is when people think about exercise, they think about work. They don't like to exercise. They feel like they're forced to exercise. However, and at the same time, I don't just encourage my patient to exercise because they can tell me that, oh, I go to the gym 1 hour a day. But what happened to the rest of 23 hours in the day? So the purpose is not just to exercise, but move around. We want to increase the physical activity. The current saying is sitting is the new smoking. We don't want you just sit there. We want you to move around. That is a physical activity part. Stress management. I don't know who can have a stress-free life. We all need stress. We all have stress. So the key point is to manage the stress. We might be able to reduce some, but it's how to manage our stress. And stress will have a lot of what we call the cortisol. And the cortisol is very inflammatory. So if we go back to plant-based nutrition, we'll mention that we have a lot of pain and inflammation in the joint. When we have pain and inflammation, the most direct way to reduce inflammation is from our food. The food we eat either reduce inflammation or cause inflammation. And so we want to make sure we avoid the pro-inflammatory food and increase the anti-inflammatory food. And that's the nutrition part. Physical activity, when we go out to simply walk, that will reduce our stress, improve our bone health, and at the same time, produce a lot of hormones in our body that make us feel good and improve our metabolism. Social connection, usually what we think about is social support. Right now, the social support is very important. The Surgeon General just mentioned last week that we have the pandemic of loneliness. So social connection is a big pillar for us. Sleep. We all know sleep is important, but how important is sleep? As simple as we usually tell people that the body heals itself. The body does heal itself. However, it happens when we are sleeping. It's not only sleeping, but also a certain stages of sleep. During the deep sleep stages, that's when the body healing occurs. And that's why it's important to have that good sleep. And passion. Passion, there are several ways the passion can improve our arthritis. Number one, it gives us a motivation to do things. A lot of time, clinicians wonder why the patients are not compliant. And sometimes it's as simple as they don't have the proper motivation. And the motivation comes from the passion. If they really want to do something they like, they enjoy, they would try to help heal their body. And number two is when you have a good passion, you bring down a lot of stress and also improve your cognitive everything right there. So passion is another big pillar in the arthritis management right here. But then people that say, but I have the genes. Yes, that's true. A lot of time, a lot of things, they are determined by our genes. However, the family shares not just the genes, but also shares a lot of habits, recipes, traditions. And those is all lifestyle related. And there is in the last 20 years or so, we have been studying the so-called epigenetics. Epi meaning around, genetics mean genes. So when you look at all those, now you have the genes here, but then you have a lot of proteins. Those are the so-called we call the epigenetics. Those proteins will determine whether the specific gene will be expressed or not. And those proteins are controlled or affected by our lifestyle, especially the diet. And that's why we like to say that bad genes load the gun, but the bad lifestyle pulls the trigger. So you may have the gene, but the gene may not always expressed. It depends on what's surrounding those genes. That's epigenetics. And that's why lifestyle is very important in managing a lot of conditions, including arthritis. So who are the presenters? I want to do a brief introduction to the presenters. Since we are in Rochester, the Mayo town, I want to give you a hint that 3 of the 5 presenters are Mayo alumni. So I'll let you guess. first presenter, Dr. Monica Agarwal. She is a cardiologist by training. She's a professor at the University of Florida. She's going to present on May 31st. The topic is the impact of inflammation on the body and the tools we have to fight it. And here, one thing I want to emphasize, or for her to emphasize, is people sometimes don't realize that rheumatoid arthritis doesn't just affect your joints. It affects multiple organs in the body because of inflammation. And so she is going to introduce the information related to rheumatoid arthritis and what body systems, organ system will be affected by the rheumatoid arthritis. And she has a very compelling, wonderful personal story to tell also. Next one, Dr. Stephen Esser. He is a physical medicine rehabilitation, we call it PMNR physician. He finished a sports medicine fellowship at a Mayo Clinic, and he's a co-founder and director of Esser Health, also in Florida. His title will be Nutrition and Your Orthopedic Health. And he's talk about physical activity and the orthopedic system. So it's not just the joints, but also how to keep your tendon, your bones healthy. And he is a 4th generation plant-based eater. It's very interesting when he said that. So we will learn more from him about the physical activity. By the way, if you go to YouTube and look at his presentation, he is very fun. It's really pure PMNR. It's a lot of physical activity, exercise, that. And he is a tennis player. Actually, he's quite accomplished tennis player. Next one, need no introduction. That's me. I'm a podiatrist by training. I am with Rochester Clinic and Lotus Health Foundation, and I completed my PMNR fellowship at the Mayo Clinic. That's how I got to Rochester, Minnesota. On June 14th, I will talk about whole person approach to manage ankle osteoarthritis. As I mentioned earlier, osteoarthritis is highly associated with lifestyle. However, osteoarthritis also has the biomechanical components, meaning it is something to do with the mechanical property of our joint or our body that would lead to osteoarthritis. We need to tackle that in order to really manage or sometimes reverse the osteoarthritis. Next one, Dr. Amy Barton. She is an overachiever. She is certified in PMNR, pediatrics, and sports medicine at Mayo Clinic. And she's also going to sit for the Lifestyle Medicine Board later this year. So she will be certified by 4 boards. And on June 21st, she is going to discuss movement is good medicine for kids too. And this is a topic I think people don't usually discuss when we think about arthritis. No, we think about arthritis as the so-called old age arthritis, and for the children, we'll only think about the juvenile rheumatoid arthritis. However, there's more than just the JRA in pediatric sports medicine. Right now, there's a trend of kids. To me, I think of the current trend is bipolar. Either kids are inactive, they just sit there and play their video games, or the other extreme is the kids who focusing on sports, want to get a sports scholarship and just do sports, single sports. And that will be the question, the issues Dr. Barton would address. The next one, Dr. Joe Furman. He is a family medicine physician by training. He coined the word nutritarian using nutrition, and he has been featured on PBS since 2011. The latest one was in 2020, titled Food as Medicine. He is a renowned author with many, many books. I remember one of the books called Fast Food Genocide. For some reason, that one's not as popular. And he is also a very accomplished athlete. I need to show that. He won the U.S. National Pair Championship in 1973 and also placed third in the World Professional Pair Skating Championship in 1976. So that's here he was skating with his sister. On June 28th, he is going to talk about lifestyle intervention to prevent and improve arthritis pain. And because his background in sports, he's going to talk about posture, gait, exercise, joint alignment, and balance. Now, I'm very impressed because I have rarely heard any family physician, primary care physician talk about these orthopedic conditions, talk about gait, talk about balance, or balance their mind, but joint alignment is very rare. And then he's going to talk about lifestyle also. As I mentioned, osteoarthritis has a lot of lifestyle and biomechanical components to it. So that is a brief discussion of the lifestyle medicine, arthritis, and our presenters. And now I will return this to Denise.
Well, hello, everyone. I'm back. Sorry about that. Dr. Lai, can you hear me now?
Yes.
Okay, better. Very excited that you were able to continue with your presentation, even though my internet decided to spontaneously combust. Incredible information. I'm glad you had a chance to go through each of the talks for the next 5 weeks, because each one of these presenters is amazing and has such great information for each one of us. And for those of you who are listening, who are here with us, thank you for being with us. For those of you who are going to be listening to the replay, if you have any questions, certainly connect with us. And of course, we hope you found this information interesting and that you see how it can be life-changing. So we'd like to invite you to join us again next week, May 31st, for our presentation with Dr. Monica Agarwal. You can sign up for each of the presentations at Eventbrite. I did just put the link into the chat for those of you who are here. For those of you who will be listening with the replay, we'll make sure you have this link, but it is at Eventbrite. You can also just click or type in rochesterclinic.com/Wellness-Wednesdays/arthritis-series. And so you can find that link, really long link that I just spelled out there for you. You can find that on Rochester Clinic website. So I would like to open, before we head out, I'd love to open for questions or comments from our audience. Anyone who is here, thoughts, comments, questions, please share.
Yeah, so like the 5 presenters and 5 topics, if there's any specific things you would like to hear from any presenter, you can put it there and we can make a request.
Questions for Dr. Lai? Okay, I have a question here in the chat. Very good. This is a great introduction. Interesting to know about the whole person approach. I look forward to future sessions, and we look forward to seeing you here again, Ellie. Thank you. Okay. Well, if no one has any additional questions or comments, again, we'd love to see you here. The next 5 weeks, we have presentations. And again, you can find us on Eventbrite. If you have any questions between now and then, please go to Rochester Clinic website, and you can connect with Dr. Lai or May, who is the head of Lotus Health Foundation. Thank you, everyone. Dr. Lai, thank you.
Thank you.